Question 1 states, reintroduce yourself and why you took this course. My name is Jasmine. I'm taking this course because I needed another 300 level class to graduate December 8th of 2022. I took fascination in this class because the concept of death and dying has just admired me. I love it. And I was hoping to learn more information about death and dying and like the grieving processes and all like the strength in the situations and getting like after help and aftercare. A cultural approach of death that I find the most interesting. Question 2. The cultural approach to death I found the most interesting was the Native American heritage. It was interesting to me because I had not learned much about the approach of death despite having Native American in me. It was something that was not spoken of much from my ancestors. It was also interesting to me because I learned that they may come in more in contact with whites, more passed away from disease, and they had no immunity to it. Native Americans see death as a transformation of one's existence and not terminated but reincarnated. I believe that those whose spirits pass goes through the spirit world and influences those who are living still every day. A few other things that have made the culture approach interesting to me was Americans emphasize the importance of living one day at a time and the purpose of gratefulness with the knowledge that it could be ended abruptly. Native Americans sing death songs as a way of summarizing an individual's life and that death has been completed. I grew up with an idea that Native Americans had rituals and celebrations of life, and it was a norm to prepare the bodies and show them that some Native American tribes fear dead bodies that relied on mortalities to prepare dead bodies. Tribes of more hunter-gatherers have less fear of death than secondary tribes. Question 3. Describe and discuss at least 2 historical contemporary implications and aspects of death and dying. When we had our discussion on honoring our ancestors, even though we never knew in week 2, among the discussion were videos we watched that talked about the culture's honors and the loved ones who passed, such as the Day of the Dead, or by the art fair. In that discussion, we talked about the history of our ancestors and how we might continue to honor the loved ones by different options of planting trees and options of animals. I learned that the historical concept aspect of dying may have changed from today, but the concept behind honoring our loved ones have not. It mostly believed that honoring our loved ones is a ways to match with our cultures, and even to our loved ones' wishes, it is the best honor to them. This is mentioned in the textbook in chapter 3. Key point is identifying and helping change society's view on death, as well as bringing appreciation aspects, death and dying, into others' beliefs. My thoughts and feelings changed the more I learned about death and dying and the historical context as well. I think it is more important because we learned that the things are done differently around the world, but the same idea is honoring our loved ones and grieving through the process of death, and similar to the context. Learning about death and dying is needed because death is a part of everybody's everyday life. Some work through the process, while others find themselves having trouble healing with death. Question 4. Identify basic legal considerations of related death. According to chapter 6 on page 225, the basic legal consideration related to death is on the right competent patient to refuse unwanted treatment. They can refuse, withhold, or withdraw treatments at any time. At that point, the patient shifted to supportive care rather than receiving life-sustaining treatments. This right is protected even when the patients cannot communicate. On page 219, informed consent and legal discussion is consideration because the most important, the patient is understood about what is going on and what could be needed to help. Another legal consideration to take into account is the state of being a patient. On page 223 of chapter 6, lists 6 disorders of consciousness. Each state Each of these states have been led to some part of the body not functioning properly and often limited to no consciousness, which makes it near impossible to have a discussion with the patient. Therefore, legal considerations of the patient wants, the family's thoughts, and so forth to come into play. Question 5. Identify basic morals and considerations related to death. Continuing in Chapter 6, a few more moral considerations related to death and physician's assistant, death, double effect, human effect, or harmful effect of treatment impermissible if harm is not intended and occurs as a big side effect. And palliative care and right to die. With physician's assisted death, while it is legal as long as it is done correctly, and it may not be done morally accepted by some. However, the process of death is done solely by the patient, not the doctor, though the doctor provides the means of doing so. This is a tricky area because the courts will look at it upon the fact that the patient refused treatment and is not morally accepted to proceed with the assisting in death. With the rule of double effect, a doctor can give a higher dose of medication to help the patient's pain levels, but sometimes that can cause respiratory problems and even death for some. Though this is unintentional, there was a known chance of it happening. However, the courts see this method as morally accepted, and if it was the intent to relieve pain. Lastly, with palliative care and the right to die, patients have the rights to choose die due to their pain levels, or are they? Or are they exhausted from suffering? With this, the studies in ethics look at the idea as not legalizing anesthesia, but instead transfer the care of the dying morally. Despite whether the patient wants to die, the doctor should not jump to the acts of being, because it could be considered immoral. Charles Daugherty discusses the context of common good and shifting the focus of how we can add simplicity and dignity into the death process can bring a different outlook for patients who prefer to just die. Question 6. Be specific in the cite chapters and discussions of videos that you've shared and knowledge and gained the past 4 weeks of the coursework has influenced some of your plans, thoughts, and behaviors of death and dying. For the future examples. What can you do in order to make a legal moral decision related to death less traumatic for yourself or your loved ones? With the knowledge that I have now, especially from Chapter 6, I can take the information and have informative discussions with my loved ones, and I can also keep this information in my mind to help me in my future career if I work in a hospice house, a hospital, or some kind of care of patients. Knowing this information on legal and moral choices, I feel like I have a better grounding on what's legally and what's morally allowed versus what is not, so that I can stay informed on decisions of my own and have good understanding of my loved ones' decisions as well. What information eased anxieties, concerns, and plan regarding the death for yourself or a loved one? The information in Chapter 6 on inheritances, such as wills, probates, and living trust, help ease my anxiety about concerns of death. This is because the information that is important to know is the work towards creating those documents. It not only makes things easier for you while you're living, but you have more clear information, but it also makes it easier on your family afterwards so they know who gets what. Seeing this among my own family, this is that there was no will. Seeing among my own family that there was no will or anything to be stated on how things should go after their death, it has led to many fights in families, causing no longer to talk to each other. That was always my concern of mine. So now it helped me to the process in those areas. The information on the insurance also helped plans regarding the death because I have a better understanding of the importance of life insurance. Has this information changed you and your thoughts influence your financial and death of a loved one or yourself? The information I've learned so far has influenced my thoughts and financial for my death and myself or a loved one. In Chapter 8 on page 311, it broke down the costs of adult funerals and viewing individuals and burial in 2017. Those prices, while not entirely alarming, are especially high with someone with no life insurance to help cover the costs. I've seen many individuals pass away unexpectedly lately. Many have not had any insurance, so family have been scrambling to find money to have a funeral for the loved ones. This chapter brought light to what goes on in preparing for a person's funeral, viewing, burial, and cremation, so it made me appreciate the work funeral homes do. What assignment had the greatest impact to help inspire change in thoughts, feelings about death? The assignment that had the greatest impact on me and inspired changes in thoughts, feeling about death for me was a discussion on the palliative care in the hospice during week 3, particularly the video on No One Dies Alone. This video shows small... This video shows such a small volunteer opportunity for someone who could mean the world for the patients. This video's going into discussion inspired my thoughts and feelings about death to realize why it is a terrifying moment for many. It can also be a comforting moment for someone with you there. Again, my name is Jasmine, and